Before we discuss the specific steps involved in reprocessing an ultrasound endoscope, it is helpful to understand the construction of the internal channels or lumens within the endoscope. This drawing shows the instrument and suction channels found in a typical radial or curved linear array ultrasound endoscope. The largest channel is the instrument channel through which biopsy forceps, needles, and other endotherapy devices are inserted. This channel is also used to suction fluids from the patient during the examination. The suction system is also connected to the balloon channel to suction or remove water from the balloon mounted on the distal tip. Ultrasound endoscopes also contain a small channel that brings air from an external air pump through the distal tip of the endoscope to insufflate the patient during the examination. A second small channel supplies water to wash the lens on the distal tip. A third small channel supplies water to inflate a balloon attached to the distal tip. In addition to these channels, if you are reprocessing a curvilinear array ultrasound endoscope, your endoscope has an elevator wire channel. CLA ultrasound endoscopes contain a channel with a metal part called an elevator that is used to manipulate accessories which have been passed through the instrument channel. The wire that controls the movement of this elevator runs in a channel called the elevator wire channel. You will find a port to access this channel on the control section of all CLA ultrasound scopes. Check the endoscope to determine if an elevator wire channel is present. If so, follow the additional steps outlined in this video to reprocess this channel as well. It should be noted that all of the internal channels of the endoscope must be reprocessed each time the endoscope is reprocessed, even if the endoscopist did not specifically use these channels during the patient's examination. There are 4 immediately after the patient procedure. Pre-cleaning removes gross debris and prevents patient material from drying onto the endoscope. The second step is leakage testing. Leakage testing ensures that the endoscope is air and fluid tight. A leaking endoscope will be severely damaged if fluids enter the instrument. Leaking endoscopes also present an infection control risk. The third step is manual cleaning. This involves thoroughly cleaning the exterior surface, all internal lumens of the endoscope, and all removable parts by wiping, flushing, brushing, and rinsing all surfaces. The final step in the process is high-level disinfection or sterilization. High-level disinfection is performed by immersing the endoscope in an FDA-cleared high-level disinfectant and ensuring that all surfaces are contacted for the specified time and at the temperature recommended by the disinfectant manufacturer. As an alternative to chemical disinfection, the endoscope may be sterilized using an approved method indicated in the reprocessing manual. Cleaning is the first reprocessing step and is performed at the bedside immediately after the patient procedure. Pre-cleaning is critical to remove gross patient debris from the endoscope before it has a chance to dry. You will need a 500 milliliter container of detergent solution nearby. Remove the balloon, if attached, by slightly inflating and then lifting up the rear band of the balloon. Discard the detached balloon. It is a single-use device. Then, gently wipe the insertion tube from the control section to the distal tip with a lint-free cloth or sponge soaked in detergent solution. Turn on the suction pump. Please note that the suction valve in ultrasound endoscopes has 2 steps. The first step, or stage, provides suction through the instrument channel. The second step provides suction through the balloon channel. Immerse the distal end of the endoscope in detergent solution. Depress the suction valve to the first stage and aspirate detergent solution into the instrument channel for 30 seconds. Then, Depress the valve completely and aspirate detergent solution into the balloon channel for 30 seconds. Remove the tip from the detergent and aspirate air for 10 seconds through the instrument channel by depressing the valve to the first stage. Depress the valve completely and aspirate air through the balloon channel for 10 seconds. Now, turn off the suction pump. Next, we will flush water and air into the air, water, and balloon channels. Confirm the light source is on, and then depress the air-water valve completely to feed water into the balloon channel. Turn off the airflow regulator on the light source. Then, remove the air-water valve and place it in detergent solution. Attach the air-water channel cleaning adapter. Turn on the light source and switch the airflow regulator to maximum output. Immerse the distal end of the endoscope in the detergent container. Depress the air-water channel cleaning adapter valve and feed water for 30 seconds. Release the adapter to feed air through the air-water channels for 10 seconds. Turn off the light source. If you are reprocessing an ultrasound endoscope with an elevator, connect the washing tube to the elevator wire channel inlet. Fill a 5 cc syringe with detergent solution and flush the channel several times. Follow this with 15 cc's of water and 15 cc's of air. Remove all valves, the air-water channel cleaning adapter, and the washing tube if attached. Place all valves in detergent solution. Disconnect the suction tube, water container, and videoscope connector. Disconnect the ultrasound connector from the ultrasound system. Disconnect the endoscope from the light source. Now, carefully transport the endoscope and accessories to the reprocessing room. Steps should be performed prior to immersing your videoscope in any fluid. Visually, inspect the water-resistant caps for damage. If any of these are damaged or wet, use another cap. Attach the appropriate water-resistant caps to the endoscope. Remember, never connect or disconnect the water-resistant cap while the cap or the endoscope is immersed. Doing so will damage the endoscope. Now, we are ready to proceed with leakage testing. Attach the leakage tester to the MU1 maintenance unit or to an Olympus light source. Turn on the air supply. If you are using a light source, be sure to set the airflow rate to its maximum setting. Depress the pin inside the connector and confirm that air comes out of the cap. Now, attach the leakage tester to the endoscope. Note that as you pressurize the inside of the endoscope, the sheath on the distal tip of the endoscope will expand. Now, immerse the endoscope in clean water. Do not leak test in detergent, as detergent will hinder visualization of leaks. With the angulation locks in the free position, angulate the endoscope tip in all directions. Deflecting the tip will help expose any pinholes that may exist in the bending section. Initially, you may see a few bubbles clinging to the insertion tube or coming out of a channel opening. These do not indicate a leak. Wipe away any bubbles clinging to the instrument. Also, manipulate the scope buttons to check for leaks. If you see no source of continuous bubbles emanating from the endoscope is air and fluid tight. In contrast, if you do observe a continuous stream of bubbles, the endoscope is leaking. Leaks like this will allow fluids to penetrate and damage the endoscope. If you observe such a leak, do not turn the air supply off. Rather, remove the endoscope from the water. Blow out the channels with air and dry the endoscope prior to turning off the leakage tester. Contact Olympus for instructions on how to reprocess a leaking endoscope prior to sending the endoscope to Olympus for repair. If no leaks are observed, remove the endoscope from the water. Disconnect the leakage tester from the air supply and wait for the bending section to return to its normal size. Detach the leakage tester from the water-resistant cap. Leakage testing is now complete. The next step is to manually clean the endoscope. Effective cleaning will remove more than 99% of the bioburden from the endoscope. Failure to adequately clean the endoscope will reduce the efficacy of any high-level disinfection or sterilization procedure which follows, and poses an infection control risk. Prepare a basin of detergent solution. Always use freshly prepared detergent at the specified concentration. Never reuse detergent solution. Remove the air-water channel cleaning adapter, the suction valve, and the biopsy valve, and place these items in the detergent solution. Carefully coil the endoscope and completely immerse it in detergent solution. Use a soft brush or lint-free cloth to clean the exterior surface of the endoscope. Pay particular attention to the distal tip and ensure that the air-water nozzle is free of debris. Take care not to scratch the small lenses and transducer. Perform all brushing while submerged to prevent splashing. If you are reprocessing an endoscope with an elevator, raise the elevator and brush the elevator and channel opening. Next, brush the channels. Start by inspecting the channel cleaning brush for any damage. If you are reprocessing an endoscope with an elevator, make sure that you lower the elevator before brushing the channel. There are 3 channel sections that require individual brushing. First, the suction channel that extends from the valve housing to the distal tip. Second, the suction channel that extends from the valve housing to the light source connector. And third, the balloon channel that extends from the valve housing to the distal tip again. To brush the suction channel within the insertion tube, insert the channel cleaning brush into the center opening of the suction cylinder. Use short strokes to advance the brush through the insertion tube until it emerges from the distal tip. Remove any debris from the bristles with your fingers and gently pull the brush back through the channel. Inspect and clean the bristles again. Repeat this process until you cannot see any further debris on the bristles. To brush the suction channel within the universal cord, insert the brush into the upper opening in the back of the suction cylinder. Pass the brush through the universal cord until it emerges from the suction connector. Clean the bristles and withdraw the brush. Once again, clean the bristles and repeat until no debris is observed on the brush tip. To brush the balloon suction channel within the insertion tube, insert the balloon channel cleaning brush into the lower opening of the suction cylinder. Pass the brush through the insertion tube until it reaches the distal end of the channel. The brush will not exit the distal tip. Remove the brush from the channel and clean the bristles with your fingertips. Repeat until all debris is removed. The next step is to clean the channel openings. Carefully insert about 1/2 of the channel opening brush into the suction cylinder. Rotate the brush and remove. Clean the bristles. Repeat this process until no visible debris remains. Now, move down to the instrument channel port. Insert the brush. Rotate and remove. Clean the bristles. And repeat until no visible debris remains. Now that the channels have been brushed, the next step is to flush the channels with detergent solution to remove any remaining debris. Connect the endoscope to a source of suction. Attach the adapter and suction cleaning tube to the instrument port. Put the suction valve in the suction cylinder. Immerse the distal tip of the endoscope and suction cleaning adapter in detergent solution. Turn on the suction pump. Depress the suction valve to the first stage and aspirate detergent solution for 30 seconds through the instrument channel. Depress the suction valve completely and aspirate detergent solution for 30 seconds through the balloon suction channel. Remove the endoscope's distal end and the end of the suction cleaning adapter from the detergent solution. Aspirate air into the instrument channel for 30 seconds. Depress the suction valve completely and aspirate air through the balloon suction channel for 30 seconds. Turn the suction pump off and disconnect the suction valve and tube. To flush the air-water channel, attach the channel plug to the valve cylinders and the instrument channel adapter to the instrument port if you are reprocessing a CLA scope. Attach the injection tube to the air pipe, the suction port, and the water and air connectors. Next, attach a 30 cc syringe to the air-water channel port of the injection tube. With the intake filter immersed in detergent, use the syringe to flush 150 cc's of detergent solution through the air, water, and balloon channels. If you are reprocessing an endoscope with an elevator, attach the washing tube to the elevator plug. Use a 5 cc syringe and inject 15 cc's of detergent into the elevator wire channel. Disconnect the washing tube and all other cleaning accessories from the endoscope and immerse them in detergent solution. Now that the internal channels are filled with detergent, wipe the external surfaces with a soft sponge or lint-free cloth to remove any debris. Soak the endoscope and accessories in detergent for the time recommended by the detergent manufacturer. The next step is to rinse the detergent from the endoscope. It is critical to remove all traces of detergent, as it may interact with or inhibit the activity of the high-level disinfectant or sterilant. Transfer the endoscope and accessories to a basin or sink filled with clean water. Wipe all external surfaces of the equipment with a clean cloth. Now, rinse the channels. Connect the channel plug, the channel cleaning adapter, and the injection tube. Confirm the suction intake filter is immersed in the water. Attach a 30 cc syringe to the injection tube's air-water channel port. Use the syringe to flush 150 cc's of water through the air, water, and balloon channels. Move the syringe to the suction port and repeat to flush rinse water through the suction and balloon suction channels. If you are reprocessing an endoscope with an elevator, use a 5 cc syringe to inject water into the elevator wire channel. The next step is to purge the channels with air to remove the rinse water. Transfer the endoscope and accessories to an empty basin. Use the syringe to flush 150 cc's of air through the air, water, and balloon channels. Repeat this process for the suction and balloon suction channels. If you are reprocessing an endoscope with an elevator, use a 5 cc syringe to inject air into the elevator wire channel. Detach the washing tube, channel plug, cleaning and injection tubes. Now, use a lint-free cloth to dry the external surfaces of the endoscope and all cleaning accessories. Visually, inspect the endoscope and cleaning accessories. If any debris remains, the manual cleaning process must be repeated. The endoscope must be completely clean before proceeding with disinfection. The next step in reprocessing the endoscope is either high-level disinfection or sterilization. If you are using an automated endoscope reprocessor or AER to perform these steps, please refer to the AER instruction manual. If using an AER, you may want to skip directly to the next chapter on storage. However, if you are performing manual disinfection, here are the steps. Start by immersing the endoscope and cleaning accessories in a compatible high-level disinfectant solution. The solution must be tested for efficacy and prepared according to the manufacturer's recommendations regarding temperature, concentration, and contact time. With the cleaning accessories attached and the intake filter immersed in disinfectant solution, use a 30 cc syringe to inject 150 cc's of disinfectant into the air, water, and balloon channels. Repeat this procedure with the syringe attached to the suction channel port. The endoscope's air-water suction and balloon channels are now completely filled with disinfectant solution. If you are reprocessing an endoscope with an elevator, inject disinfectant into the elevator wire channel using a 5 cc syringe. Now, disconnect all accessories while making sure all items remain submerged. Cover the disinfectant basin with a tight-fitting lid in order to contain the disinfectant vapors. Disinfect the endoscope and reprocessing equipment by soaking them in accordance with the disinfectant manufacturer's instructions. Use a timer to confirm that you are achieving the proper contact time. After soaking the equipment in the disinfectant solution for the recommended period of time, reconnect the reprocessing accessories to the endoscope. Remove the intake filter from the disinfectant solution so that it will draw up air. Connect a sterile syringe to the air-water channel port and pump at least 5 times to expel the disinfectant from the air, water, and balloon channels. Move the syringe to the suction port and pump at least 5 times to expel disinfectant from the suction channels. At the end of the process, you should observe air bubbles exiting the channel openings. If you are reprocessing an endoscope with an elevator channel, inject air to expel disinfectant from the elevator wire channel using a 5 cc syringe at least 3 times. Now that all of the channels have been emptied of disinfectant, the next step is rinsing. It is very important to remove all disinfectant solution from the endoscope. Residual disinfectant is hazardous and can injure the next patient examined with the endoscope. Start by transferring the endoscope and accessories to a clean basin filled with fresh rinse water. If sterile water is not available, fresh tap water or water that has been processed or filtered to improve its microbiological quality may be used instead. However, always consult with the infection control representative within your facility on the hospital's policy regarding water quality. With the instrument submerged, use a fresh, sterile, lint-free cloth to thoroughly wipe and rinse all external surfaces. Next, with the intake filter immersed in the rinse water, use the syringe to flush 150 cc's of rinse water through the air, water, and balloon channels. Move the syringe to the suction connector and do the same to rinse the suction channel. If you are reprocessing an endoscope with an elevator channel, inject 15 cc's of water into the elevator wire channel using a 5 cc syringe. Remove the endoscope and accessories from the rinse water basin and place them into a clean, dry basin. Use the syringe once again to flush any remaining water out of the suction channel. Move the syringe and flush out the air, water, and balloon channels. Detach the injection tube. Attach a clean suction tube to the suction connector. Turn on the suction pump and aspirate air for 15 seconds. Turn off the suction pump. Disconnect the suction tube and channel plug. If you are reprocessing an endoscope with an elevator, inject air into the elevator wire channel in order to expel rinse water from this channel as well. Use a sterile lint-free cloth to thoroughly dry the external surfaces of the endoscope and reprocessing accessories. In the event that non-sterile water was used for the final rinse, perform an alcohol flush of the endoscope channels. If using sterile water for the rinse, Olympus recommends an alcohol flush to aid in the drying process. If you plan to store the endoscope, ensure that all channels of the endoscope are dry. Wet channels promote the growth of microorganisms and present an infection control risk. Prior to storage, remove the water-resistant caps from the endoscope. And make sure that all valves have been removed. Also check that the angulation locks are in their free position. Now, hang the ultrasound endoscope in a storage cabinet. The distal tip should hang freely, with the insertion tube as straight as possible and avoiding contact with other instruments. A word of caution: do not use the endoscope's carrying case to store patient-ready equipment. Any endoscope placed in its carrying case must be reprocessed prior to use with another patient. You have now reviewed the steps required to safely reprocess your Olympus ultrasound endoscope. To summarize, there are 4 major parts to endoscope reprocessing. Number 1, it is mandatory to pre-clean the instrument at the bedside to remove patient debris immediately following the procedure. Pre-cleaning prevents patient material from drying onto internal and external surfaces of the endoscope. 2. Leakage testing is required to ensure that the channels and insertion tube are not damaged and that all seals are air and watertight. Routine leakage testing prevents costly fluid invasion and therefore high-cost instrument repairs. Never use an endoscope that has a known leak on a patient. 3. A critical step is meticulous manual cleaning with a detergent or enzymatic solution. Use appropriate brushes and cloths to thoroughly clean all exterior surfaces and internal lumens. High-level disinfection or sterilization is the next reprocessing step. High-level disinfection kills or inactivates any remaining vegetative bacteria, viruses, and fungi. It is important that you test the disinfectant solution regularly for potency and use it at the temperature and for the contact time recommended by the manufacturer. Also remember, disinfectant solutions are toxic. Wear appropriate personal protective equipment throughout the entire procedure and thoroughly rinse all disinfectant from the endoscope prior to the final alcohol flush drying procedure. This training video presents a general procedure for endoscope reprocessing. Consult the instruction manuals that came with your endoscope for specific details on how each particular endoscope must be reprocessed. Certain model endoscopes may have features that require additional specific steps. Olympus also offers on-site and off-site training, wall charts, and other reprocessing materials and aids. Refer to the Olympus America website at www.olympusamerica.com for additional information. Thank you for viewing this video on ultrasound endoscope reprocessing. Olympus, your vision, our future.